Well, you know, it's always fun to be right here at the New Vision Eye Center with Dr. Roger Meyer. Dr. Meyer, it's great to see you again.
It's great to see you again also.
Do you know, I have to say that when we talk about so many of the physicians here at New Vision, we all think that when 2 or 3 are gathered together, they talk about the expert treatment that you all give all of us to make us look better and see better. But I want to talk about your specialty in particular, because first of all, how long have you been with New Vision?
Oh, I've been with New Vision since it was founded. I've been with Dr. Minotti since 1986.
There you go. Top of the line, top of the line. Well, Dr. Meyer, what I'd love to do is find out really about your specialty, because I think what we're doing here is letting all of the viewers understand that there are specialists and experts in every field of good eye care here at New Vision. What would you say is your specialty?
Well, my particular background is in the retina. I did a fellowship in surgical and medical retina surgery, vitreous surgery, treated things like retinal detachments and epiretinal membranes, but the majority of it these days is macular degeneration, diabetic retinopathy, vascular diseases such as vein occlusions and things like that.
Could that be because of the demographics here? And
Yes.
All right, I said it, you didn't.
Correct.
But it does make it makes so much sense though, because I think we're all discovering that we can see and feel better if we get diagnosed early. Is that a key?
That is absolutely one of the keys for macular degeneration in particular. We used to not have any good treatments for macular degeneration. We told people, well, you know, it's old age and you're going to go blind and there's nothing we can do about it. And then in the 70s they developed the laser, and we said, well, we can cauterize the blood vessels that are leaking and it will stop them from growing, but you'll be blind, but you'll be less blind than if we let the disease progress.
Oh, golly.
But lately, we've developed some new drugs that are injectable into the eye, and when you catch the disease early and you prevent scar tissue and atrophy and death of the retinal cells, oftentimes, almost 50% of the time, we get improvement of the vision with treatment if it's started early enough.
Do we know what causes macular degeneration, not just the age factor?
There are many factors that influence it. There may not be just one. Part of it is genetic. Part of it is exposure to sunlight, diet. It's linked to blood pressure. Smoking is a big risk factor. But age is sort of the big common denominator. But there are even types of degeneration. We don't necessarily call them age-related macular degeneration, but there are genetic ones, and some of those are exciting because they're the ones where they're having the best luck with stem cell treatments and things like that to treat them, because there's some very specific gene defects.
Dr. Myers, I've often wondered though, because so many people talk about the diabetic eye. What is a diabetic eye?
Well, diabetes damages the blood vessels in the back of the eye, and it makes them a little bit leaky sometimes. It can also close them down and make it so that they're not delivering blood flow to the eye. Either situation can result in loss of vision. The ones that we have pretty good luck with treating are the ones where there is leakage. And again, it's the same drug that we use to treat macular degeneration that is effective at stopping the leaky blood vessels from diabetic retinopathy. But you get little outpouchings that we call microaneurysms, and they leak fluid and cause swelling in the retina. The ischemic type or proliferative type of diabetic retinopathy can be treated with these drugs too. It's very effective, but laser is also very, very effective for that.
Oh boy, the combination of all of this, and of course talking with all of you physicians here at New Vision, I think it just makes us realize we have come so far in what you can do. And you mentioned the diabetic eye, and I remember years and years ago, you were, as a child, if someone was diagnosed with diabetes, they were going to be blind.
There was a very good chance of that.
And so now, of course, we have come a long way. Treatments are specifically, though, designed, as you say, in some cases, even in combination. But Dr. Meyer, when we think about some of your specialties with this macular degeneration, what would be the first symptom that one of your patients would have experienced in order to make that appointment?
It varies, but they notice a defect or a problem with their vision. Typically, it's either blurriness, a blank spot in their vision, distortion or waviness of the vision is another big one. Those are the big ones that should get them to call the eye doctor and get in right away and make sure they emphasize that they're having these specific types of changes in their vision.
All right, I'm going to ask you one more question, and I do this every time I come to New Vision and see Dr. Roger Meyer and talk to you. What are floaters?
Floaters, most of the time, are just pieces of the vitreous jelly that have pulled away and separated from their attachments to the back wall of the eye. And now that they're free-floating in the fluid in the eye, they cast a shadow, and you see them moving by as when you move your eye.
Sure.
But we can also get floaters from blood in the eye, which is a much more serious condition. You can have that from retinal detachments, retinal tears, and diabetic retinopathy and things like that. So floaters should be investigated if there's a sudden onset and dramatic.
And just very quickly, the detached retina is from a head trauma?
No, not necessarily. Most of the time it's just out of the blue. The jelly shrinks and it pulls on the peripheral retina and tears it.
Wow.
And typically it'll tear it across a blood vessel, and that's where the floaters come in. Droplets of blood squirt out into the middle of the eye. And now you've got a flap of the retina that's moving with the jelly, and that stimulates the retina to fire nerve impulses back to the brain, and that causes the flashing lights.
Wow. I can tell you this is one of the reasons I absolutely am so impressed with New Vision Eye Center and every single thing that you do. Not only do you all keep up with the innovative new procedures and new treatments, but you give excellent care, and you do make us see better and look better. And I have to tell you, it's delightful to see you.
Well, thank you, Marcia.
Dr. Roger Meyer, right here at New Vision Eye Center.